there, I'm Dr. Debbie Smith. I want to give you a little bit of a feeling for what we do at the point of origin practice to treat muscle or chronic injuries or recent injuries, as I believe what we do is quite unique and we look at a whole comprehensive system. So what would happen is if you're prone to chronic injuries, our first question we're going to ask is why? Why are you prone to it? So a lot of people are deficient in vitamin D. So even where we are in sunny South Africa, people don't tend to spend time outside, or if they're outside, they put sunscreen on, and as soon as you put a factor of 8 on, you block the benefit of the sun, the good stuff in your body, and you become D deficient. Now, vitamin D deficiency has been linked to 500 different problems in our body, and one of them is unexplained joint and muscular pain. And this is also going to make, if you're vitamin D deficient, more prone to inflammation, and inflammation is going to cause a problem where you are going to get more muscle problems and injuries. So the first question we're going to ask is, why is this? Another reason potentially could be acidity. If you're too acidic in your body, so if you're eating a lot of refined foods, sugar, wheat, all those things is going to create acidity. More acidic, it's going to sit in your joints, it's going to affect your potential to get injuries as well, and not just that, and the recovery. So the first question is why. Another test we do for the why is we can do a DNA fit sport test, and that looks at if you are prone to injuries. What is the reason for it? Is it because you're forming more oxidation than you should? You need more base training. And the DNA test is very simple. It looks like a big earbud. It's done inside of your mouth, and it's sent off to the lab, and we analyze certain genes to see why are you prone to injuries. So that's another tool we can use for muscle injury. So let's say now you've got the muscle injury or the joint injury. How do we then treat it? So what we will do is we will look at where is this area, and we will focus our treatment on something called fascia. Now your fascia, very interesting, it's between your skin and your muscles, and it's basically like a sheath. But the way I want you to visualize it is like a mesh that's interlinked at different angles. And what happens is if you've got an injury, this thing either shrinks like cling wrap, or it's going to stretch more out. And we are focusing on the fascia to put it back into position. Because if the fascia is not in the right position, it doesn't matter if you're massaging the muscle. If you're not releasing the fascia, the muscle is going to go back into the tight position that it was before. And to give you an idea, all fascia in the body is linked. So if I turn my head towards the left side, there's a pull that's happening from my right leg. Even though I don't feel it, this is happening in the body the whole time. And it's called a kinetic chain. So you might have a neck pain here, but it's actually being influenced by your hip. So we've got to treat all of it to make sure that the body is moving in a very smooth, easy way. So we focus on the fascia. And one of the tools that we use with this is Chinese medicine called Gang Sha. And what we've done is we have brought it into modern day society, and we use very specific myofascial tools. I want to show you one of them now. I call them my ninja tools because they look like ninja tools, but it's not painful at all. So the tools are beveled at a very specific edge, and there's quite a few different tools depending on which part of the body you're using. And all that we'll do is, let's say the forearm is tight, we'll just rub the forearm and we'll go in all directions, and we'll see where there's a tightness, and there where we can feel a tightness, we'll work a bit more on that to release the fascia. And after we release the fascia, the muscle will feel much better. Sometimes I have noticed that I only have to do a few minutes, literally 5 minutes, and it's nearly the equivalent of doing a half an hour deep tissue massage, the effect that it gives, because we get exactly to the points where we want to be. So our Gasha tool, myofascial release tool, very effective for treating muscle and injuries. Then what we do is we use acupuncture. So acupuncture, a lot of people think it's painful, but it's not at all. We use very thin needles to still get a proper effect in the body, and we don't use dry needling. So for 1 second on dry needling, This is what physios and chiropractors use more. They will say there's a spasm. Let me put the needle in, let me twist it to release the spasm. That is dry needling. Acupuncture is based on using your own body's healing mechanism, getting the nervous system to work, sending blood flow to where the area is, and then helping to sort the injury out. So we obviously only use brand new needles per patient. I'm going to come a bit closer. This is a typical needle that we do use. You can see the needle is super fine. I'm battling even to focus it in the video for us. And what we do is when we put it in, we just basically pop it in there. And then there's the needle in there. You can see I didn't flinch. It's not painful. I do use acupuncture for some children as well. And it works very effectively. So we will say there's a problem in the body. How do we get the energy to move? And then we use acupuncture in conjunction with that. So as we said, we focus on the fascia. So we use our tools. We use acupuncture. We also use something called biopuncture. And what biopuncture is where we use very specific homeopathic remedies and we inject it either into the injured site or we can even inject it into acupuncture points where there's homeopathic medicine in there. For example, things that can reduce inflammation. If there's a disc problem in the neck, we can use something specific for discs. If it's a joint problem, we use another remedy. So we use a combination of different homeopathic remedies and inject, and that's called biopuncture. The next thing we do for muscle and injuries is something called bloodletting. So this is very interesting because it sounds a little bit medieval, but I want to explain to you in a moment how it works and how you'll see how the combination of all the tools that we use is the most effective. So what happens is, on your skin, and particularly when you look at the back of your legs, there's blood vessels that's popped up. This is the superficial blood vessels. This superficial blood vessels that now you see the color is darker, it's maybe blue or maybe even purple, penetrates the skin. It is connected to deeper blood vessels. Now what happens is when there's the blue color, it tends to show congestion, old blood. So what happens is this blood vessel, superficial, lead into the deep one. So instead of this artery or vein being that size, it is suddenly much bigger. And what happens is, when it's bigger, it is pushing against nerves, and that gives you nerve pain. So for example, someone with sciatica, this extreme nerve pain down the butt, some people all the way down to their leg, it's the pressure of the vein that's causing part of the pain. So what we do is give a very small prick, we let the blood out, the color of the blood vessel starts to improve and pain improves. I've had it before where I've had patients that come in and they battle to walk in. We only do bloodletting, tell the person please walk, and then their pain would be reduced already by 40%. And then we start using the other adjuncts to treat musculoskeletal. So let's go on with what else we treat. We also use cupping. Cupping works like the gusher, but the way it's going to work is just a different tool. We use little cups to help release the muscle problem that is there. And cupping obviously became very famous after this Olympic. We saw all the swimmers with it. So swimmers tend to use it, or athletes use it to recover quicker if they've got spasm, pain, works very effective. What a lot of people don't know, cupping can even work very well for stress and anxiety and when you're very tired, because we work on a very specific acupuncture meridian, and that's going to alleviate, and therefore it's going to help improve the symptoms that's happening there at the moment. So the other thing we also do for musculoskeletal problems is we look at the emotional connection. The emotional. Because the emotional can also cause problems. A lot of times we experience the emotional when it is perhaps a patient that had no reason for the problem to start. They didn't have an injury, they didn't sprain their ankle, they didn't do any of that sort. And to give an example, we maybe see a patient who's got knee pain. The knee represents moving forward, and then we see particularly that these people, they maybe had a problem that they're still feeling stuck on. Then what we do is we give some Bach remedies, some homeopathic remedies, and we help the emotional side of the body as well. In my other video, I explained that we're not just physical beings, we're mental and emotional as well. So therefore, we do address the emotional component as well from a musculoskeletal point of view. So I'm sure, as you can see, the way we treat muscles and injuries is very comprehensive. We don't just look at one aspect. We look at all the aspects. We use as many tools as possible. We even have a bioptron machine that can become part of the treatment, bioptron. It's a machine that reduces inflammation significantly, improves blood flow, because blood flow is what we need to help for healing. In fact, in acupuncture, that's one of the main things that we do, improve blood flow. If you think of children below the age of 3, they might fall 3,000 times and they hardly injure themselves. And even if they cut themselves, the blood is bright and is red, new blood. As we get older, our blood flow starts to reduce, we become blood deficient and blood stagnant. The blood's not moving the way it should. So when we have injuries and it takes a very long time to heal, it's all to do with blood flow. And all the tools that we use improve blood flow. More blood flow, healing can take better place. So what happens is a lot of people say, I'm in pain, how often should I come? Very common question for musculoskeletal. So if you're in severe pain, we suggest you come every day until the pain has started to subside. Normally for people it's maybe about 3 to 4 treatments. If it's a chronic problem, you need to come at least twice a week so that we can resolve the problem for you, where your body is going to be not in any disease state, in a state of dis-ease, not being comfortable, and we can improve the muscular, the joints and the injury system very quickly. And another pull to remember is if you do get an injury, it's best to treat it immediately so we can help the body's healing response to what's happening at the moment and resolve the issue very quickly. As you will notice on my blog, if you go to askdrdebbie.com, I wrote quite a few newsletters. I broke my arm very bad, close to the joint. I had about 20 pins, 3 plates in my elbow. So I really do know a lot about helping for fractures even as well, how to help heal the body for injuries. If you read there, you'll also read about the journey that is part of what I've been through, that's also given me this passion to help other people so that they can solve their problems. And as I'm thinking, I've discussed all the physical stuff and the emotional, but I did not discover nutritional deficiencies. Nutritional deficiencies, besides the vitamin D we discussed, can also cause injuries. And some of that could be, for example, magnesium. So we look again very comprehensively on every aspect of muscle and skeletal system to improve for you. I hope you found this very informative. There's a lot of information also on the other website, drdebbie.co.za, and you can read up about all the information a little bit more. I hope you enjoyed this talk.